You wake up for surgery, but it's not a hospital. It's 2500 BCE. There's no anesthesia, no antibiotics, just a priest with a bronze blade, murmuring prayers. And somehow, you survive. Sounds terrifying? It was. But it also worked more often than you'd think. This isn't historical fiction. It's real. Long before modern hospitals and lab coats, humans were already diagnosing illness, stitching wounds, and crafting medicines from earth, metal, and memory. They had no microscopes, no X-rays, but they did have scalpels, clinical case notes, and surprisingly effective methods of care passed through generations. From ancient India to Egypt, China to Mesoamerica, early healers developed systems so refined we still feel their influence in today's pharmacies, ethics, and surgical procedures. These weren't accidental remedies or blind rituals, they were structured, evolving sciences. Welcome to Armchair Archaeology, where we explore the forgotten innovations that shaped the modern world. And stay with us, because one medical practice we'll reveal at the end might just rewrite what you think you know about brain surgery and about human ingenuity. Before we dive into the origins of medicine, don't forget to subscribe to Armchair Archaeology. We're unearthing the hidden roots of modern life, one episode at a time. And you won't want to miss what's coming next. How far back does medicine really go? Long before cities rose or alphabets formed, humans were already trying to heal each other, not with theory, but with instinct, touch, and observation. Let's rewind even further, to a time before writing, before cities, when healing began as a quiet revolution in survival. In Shanidar Cave, in modern-day Iraq, archaeologists uncovered the skeleton of a Neanderthal man who had been blind in one eye, crippled, and badly injured, yet had lived for years after his wounds. Someone had cared for him, fed him, cleaned his injuries. This wasn't just survival, it was healing, practiced tens of thousands of years before civilization. As cultures took shape, that basic instinct became something more systematic. In ancient Sumer, clay tablets from 2100 BCE list treatments for fever, wounds, and snake bites. Indian texts like the Rig Veda and Sushruta Samhita outline surgeries and herbal formulas that still echo in Ayurveda today. In China, early medical texts mapped organs, pulse patterns, and seasonal illnesses, forming a system that evolved for millennia. Egyptian healers combined spiritual knowledge with pragmatic care. The Edwin Smith papyrus from around 1600 BCE reads like an early surgical textbook, cataloging injuries, detailing procedures, and even assessing patient prognosis. Its language is direct, clinical, and grounded in experience. Across cultures without contact, early civilizations shared core principles: observation, sanitation, the use of tools and herbs, and a commitment to care. These patterns suggest something more than coincidence. They reflect a common human drive. Long before laws were written or cities were built, people were already treating pain, setting bones, and stitching wounds. Medicine didn't arise from civilization, it helped create it. Healing was one of the first forms of knowledge we passed on, not just to survive, but to live with intention and care. Healing has never been just a matter of technique. From the beginning, it's carried a deeper weight: responsibility, restraint, and trust. In the ancient world, the decision to treat another human being came with expectations that extended far beyond knowledge or skill. By the 5th century BCE, Greek physicians trained in the school of Hippocrates were expected to swear an oath that defined their moral obligations. The original text, far more detailed than the phrase "do no harm," included promises to protect patient confidentiality, avoid harmful procedures, refuse to exploit patients, and act only in the interest of the sick. This wasn't law, It was identity. In India, the Karaka Samhita, a foundational Ayurvedic text, described the physician as someone who must be clean, composed, honest, and deeply devoted to lifelong learning. The ethical character of the healer was inseparable from the treatment they provided. Ancient Chinese medicine, guided by Confucian ideals, placed similar emphasis on moral virtue, teaching that a physician who lacked compassion or self-discipline could not truly heal. In Egypt, temple doctors were often priest-physicians who underwent purification rituals before treating patients. Healing was considered a sacred responsibility, and entrance into the profession was accompanied by spiritual preparation as well as practical training. These frameworks arose in places separated by oceans and belief systems, yet they reflect a shared understanding that healing is never neutral. Even in the absence of modern oversight, early societies recognized that medical authority had to be tempered by ethical responsibility. Centuries before licensing boards or malpractice insurance, ancient healers accepted that their work rested on something deeper than technique. They knew that medicine begins not with knowledge but with trust, and that trust must be earned with every decision. In ancient Egypt, medicine wasn't confined to temples or theory. It was practiced, taught, and written down. And few aspects of it are as astonishing as surgery. Without anesthesia or antiseptics, Egyptian physicians still managed to treat injuries with methods that feel startlingly familiar. Surgical knowledge was passed through generations, recorded in texts like the Edwin Smith Papyrus, dating to around 1600 BCE. This remarkable document outlines dozens of trauma cases, each with detailed observations, diagnoses, and suggested treatments. Wound closure, dislocated jaws, spinal injuries, it's all there, approached with clarity and logic. Imagine walking into an ER today and hearing the same triage terms: treatable, uncertain, untreatable. The format hasn't changed, the tools have. Each case concludes with a prognosis: treatable, uncertain, or untreatable. Language strikingly close to the way emergency medicine works today. Egyptian doctors had access to a wide range of instruments: bronze scalpels, bone saws, forceps, and cauterization hooks. These tools weren't ceremonial. They were used in operating rooms staffed by trained professionals. Some surviving instruments are nearly indistinguishable in form from their modern counterparts. What makes these practices even more extraordinary is the outcome. Far from being acts of desperation, many surgeries were routine and often successful. Evidence of bone healing and post-operative recovery in mummies suggests that survival wasn't rare, but expected. Beyond Egypt, ancient Indian texts described procedures for setting fractures and even performing cataract surgery. The physician Sushruta outlined over 100 surgical instruments, some designed for intricate, delicate tasks. We often picture ancient surgery as brutal or rudimentary, but the historical record tells a different story. Early surgeons worked with focus, planning, and a clear understanding of anatomy, often honed without the benefit of dissection. Their goal wasn't just to stop the pain, it was to restore function, preserve life, and push the limits of what healing could mean in a world without modern tools, but not without knowledge. If you're fascinated by how advanced ancient medicine really was, you'll love our companion ebook, Secrets of the Ancient World. From surgical tools to mysterious technologies, it's packed with discoveries that will challenge everything you thought you knew about ancient civilizations. Check the pinned comment for the link. Before microscopes or molecular formulas, healing often began with observation and the earth itself. Ancient physicians looked to leaves, roots, seeds, and fungi, testing their effects with a mix of tradition, experience, and patient feedback. Many of those early remedies are still part of modern medicine today. In China, Early pharmacological texts, like the Shenong Benkao Jing, catalogued hundreds of herbs by their qualities and therapeutic uses. Plants like ginseng, ginger, and licorice were used to treat inflammation, fatigue, and digestive issues. Uses now backed by clinical research. In India, the Sushruta Samhita and other Ayurvedic texts outlined herbal formulas tailored to body type, season, and disease, some still used in contemporary wellness practices. Egyptian healers relied on garlic, aloe vera, honey, and frankincense, not only for spiritual rituals, but for wound care, digestive health, and infection prevention. Greek physicians, including Hippocrates, recommended willow bark for pain, long before its active ingredient, salicylic acid, became the basis for aspirin. In the Americas, indigenous healers treated wounds with yarrow and echinacea and used coca leaves as a natural anesthetic. These weren't just folk remedies. They were field-tested formulas, refined by centuries of trial, error, and real-world results. Modern pharmacology continues to rediscover what ancient systems already knew. Compounds found in reishi and cordyceps mushrooms, long used in traditional Chinese medicine, are now under clinical study for immune modulation and anti-tumor properties. Scientists estimate that over 40% of today's pharmaceuticals are derived directly or indirectly from plants. The ancient pharmacy wasn't a dusty shelf. It was the landscape itself, carefully studied by people who understood that health could be drawn from the living world. These early healers didn't just forage. They documented, adjusted, and refined. Their knowledge, rooted in soil and memory, still shapes the way we treat illness today. Not all ancient remedies came from plants. Some were pulled from stone, flame, and metal. Ancient physicians didn't just observe nature. They altered it, using minerals and extracted compounds to push the boundaries of healing. The results were mixed. Some treatments were effective, others dangerous, but the pursuit itself reshaped medicine. Not everything in the ancient toolkit was safe. Some ingredients straddled the line between cure and poison. Opium was among the most powerful tools in the ancient medical arsenal. In Mesopotamia and Egypt, it relieved pain, calmed the nervous system, and helped patients endure surgery. Medical texts from Egypt describe how opium was diluted and administered in precise doses, suggesting an early grasp of pharmacological control, developed through practice, not theory. Other substances walked a finer line. Greek doctors used white lead in skin ointments. Mercury appeared in Chinese and Persian elixirs, often tied to spiritual longevity. Arsenic was taken in small amounts for respiratory issues. Though toxic in excess, these treatments were carefully recorded, adjusted, and tested. They weren't blind guesses. They were part of a long process of trial, error, and revision. In Egypt, early distillation techniques allowed healers to concentrate mineral solutions and essential oils. These methods, refining a substance to increase its potency, foreshadowed modern pharmaceutical chemistry. The work was risky, but deeply systematic. There was no concept of atoms or molecules, yet the logic of cause and effect guided ancient chemists. They documented how the body responded to dosage and preparation, and they altered their approach accordingly. The tools were primitive, but the mindset was anything but. Healing was no longer confined to what grew in the ground. It extended to what could be transformed by fire, stone, and human ingenuity. In the quiet rooms of ancient workshops and temple labs, the earliest roots of pharmacology were already taking hold. Which ancient remedy surprised you the most? Opium as anesthesia, or Mercury as a so-called elixir of life? Drop your thoughts in the comments. We want to know what you think about these bold and sometimes dangerous experiments. Health isn't only shaped by medicine, it's shaped by infrastructure. Long before people understood microbes, ancient societies recognized that clean water, waste removal, and hygiene could prevent illness on a massive scale. In the cities of the Indus Valley Civilization, dating back to 2600 BCE, homes were connected to covered drains, and wastewater was funneled away through advanced sewer systems. Bathing platforms, brick-lined latrines, and municipal planning suggest a deep concern for cleanliness, one that rivals many early modern cities. In Egypt, hygiene was woven into spiritual practice. Ritual bathing, linen garments, and temple cleanliness weren't just symbolic. They reduced the spread of disease and protected vulnerable populations, especially in densely populated areas. Personal hygiene, though religiously framed, had public health consequences. The Greeks emphasized environmental health, often choosing city locations based on climate, airflow, and access to clean springs. But it was Rome that scaled sanitation into an empire-wide system. Aqueducts brought fresh water into urban centers, public fountains ensured access for all classes, and multi-seat latrines with flowing water carried waste out of cities. The Cloaca Maxima, Rome's massive sewer, still functions today, a testament to their engineering and foresight. These weren't just conveniences. They were deliberate public health strategies. Officials known as aediles maintained cleanliness, inspected water supplies, and enforced sanitation laws. In a world without antibiotics or vaccines, prevention depended on engineering. These cities didn't just build for comfort, they built for survival. Even without germ theory, ancient civilizations understood that disease followed filth, and that clean water and waste management saved lives. Their efforts turned city planning into a medical tool, one that protected entire populations. Modern public health still echoes these lessons. When we build systems to protect the many, we're continuing a conversation that began not in hospitals, but in streets, baths, and brick-lined drains thousands of years ago. When we think of ancient medicine, we often imagine improvisation, sharpened stones, or herbal pastes mixed by hand. But archaeological evidence tells another story. The ancient world had tools crafted with precision, purpose, and surprising technical sophistication. In Egypt, surgical kits included bronze scalpels, forceps, clamps, and cautery hooks. These weren't symbolic items, they were used in real procedures, described in medical texts like the Edwin Smith Papyrus, which laid out how to treat wounds, fractures, and dislocations step by step. Many of these tools were designed for specific tasks, from cutting tissue to stopping bleeding. The Greeks and Romans expanded this toolkit even further. In Pompeii and other Roman towns, entire surgical kits have been recovered, containing bone levers, blunt dissectors, needle holders, and vaginal specula. Some of these instruments are so precisely formed that modern surgeons can immediately identify their function, because the design hasn't changed. In India, the physician Sushruta described over 100 surgical tools in texts dating back more than 2,000 years. He outlined procedures for everything from cataract removal to cosmetic surgery, using tools adapted for precision in delicate environments like the eyes and skin. China, too, developed tools for therapeutic precision. Acupuncture needles, originally made of bronze and bone, were designed to stimulate internal systems without cutting into the body, demonstrating an entirely different, yet equally refined, understanding of medical intervention. Across continents, these instruments weren't afterthoughts. They were extensions of skilled hands, tools that transformed healing into a discipline. The continuity is unmistakable. From ancient bronze blades to modern stainless steel scalpels, the form and function have carried forward. By the way, If ancient surgical instruments and medical tech fascinate you, our ebook dives even deeper into these innovations and other ancient engineering marvels you've probably never heard of. You'll find the link in the pinned comment. Long before the operating room, surgery was already a craft, one that demanded the same qualities it does today. Steady hands, sharp eyes, and tools designed to serve both. Understanding the human body has always been essential to healing, but in the ancient world it came with limits. In many societies, cutting into a human corpse was seen as a violation, not a study. Religious, cultural, and spiritual taboos often made dissection forbidden or deeply restricted. Yet somehow, medical knowledge continued to grow. In India, the Sushruta Samhita encouraged medical students to observe anatomy using natural decomposition. Corpses were left in running water to soften tissue, then gently examined. Without formal dissection, they still catalogued muscles, organs, and blood vessels with surprising detail. In China, anatomy evolved through external observation, pulse diagnosis, and a holistic understanding of the body's systems. Practitioners created internal maps based on centuries of pattern recognition, not cutting, but listening, touching, and inferring. Egyptian medicine showed awareness of internal anatomy, likely from mummification practices. While the goal wasn't scientific dissection, embalmers gained an intimate familiarity with organ placement, structure, and deterioration. But in Hellenistic Alexandria, during the 3rd century BCE, something exceptional occurred. Physicians like Herophilos and Erasistratus, supported by the Ptolemaic rulers, were permitted to dissect and possibly vivisect human bodies. Their studies led to discoveries about the nervous system, the brain, the liver, and the circulatory system that would be lost and rediscovered centuries later. Elsewhere, where dissection remained taboo, physicians relied on animal anatomy or second-hand knowledge, limiting precision. Still, progress continued, driven by curiosity, necessity, and close observation. Across cultures, the desire to understand what lay beneath the skin pushed against the boundaries of belief. Even without permission to open the body, early physicians found ways to learn from it. Their maps may not have always been accurate, but the journey they began toward understanding the human form never stopped. Long before vaccines had a name, ancient societies noticed something strange. People who recovered from certain illnesses rarely got sick again. Without microscopes or knowledge of viruses, healers began to explore why some survived and whether survival could be shared. In China, by the 10th century CE, physicians practiced variolation against smallpox. Powdered scabs from infected patients were introduced into healthy individuals through the nose, hoping to trigger a mild case and long-term protection. It was a dangerous procedure, but one that often worked. In India, similar techniques were performed through small cuts in the skin, methods based on careful observation of disease patterns. In the Middle East, camel herders noticed that exposure to camelpox protected people from the deadlier smallpox virus. Though they didn't understand viral similarity, they understood resistance and passed this knowledge through oral tradition. Without labs or microscopes, they recognized patterns and took action. It was practical epidemiology, centuries ahead of its time. In the Americas, Aztec healers tracked disease cycles and observed how those who recovered often avoided reinfection. During outbreaks, they quarantined the sick and adjusted rituals to prevent spread. These were early forms of public health policy, grounded in experience rather than theory. These practices weren't uniform, but the logic behind them was consistent. Immunity could be acquired, and illness could be prevented by calculated exposure. That insight would later become the foundation of modern vaccination. The leap from observation to action, choosing to introduce disease in a controlled way, shows a level of medical reasoning that's easy to underestimate. Ancient healers didn't just fear disease. They studied it, remembered it, and looked for ways to outsmart it. Enjoying this journey through ancient ingenuity? Consider leaving a super thanks to help us keep digging into history's most fascinating forgotten stories. Centuries before germ theory, they were already working with its consequences. The body, they believed, could learn, and that lesson might just save a life. In a world of gene therapy and AI diagnostics, ancient medicine might seem obsolete. But today, some of the oldest healing systems are influencing how modern care is delivered, especially in the search for approaches that treat the whole person, not just the disease. Traditional Chinese medicine, TCM, with its emphasis on balance, herbal remedies, and acupuncture, is now integrated into hospitals and clinics around the world. Researchers study how acupuncture affects pain modulation, hormone regulation, and inflammation. Ancient texts guide herbal treatments currently under laboratory review. Ayurveda, India's 3,000-year-old medical tradition, focuses on personalized care, digestion, and mind-body balance. Its dietary models and detox routines, once considered alternative, are being re-examined in light of modern studies on gut microbiota and chronic inflammation. The Greek idea of humorism is no longer a diagnostic tool, but the underlying belief in bodily balance and lifestyle-based health remains central to preventive medicine. Concepts once rooted in ritual are now being quantified in clinical trials. Meditation, breath control, plant-based diets, and seasonal health routines, core elements of ancient healing, are becoming part of integrative medical protocols. What was once intuition is now data. What was passed down through stories is now supported by imaging, biomarkers, and peer-reviewed studies. This isn't about returning to the past. It's about recognizing that ancient medicine developed in response to human needs that haven't changed. The need for connection, resilience, and sustainable care. In systems once overlooked, modern science is finding tools to meet today's challenges. Far from fading into history, ancient healing traditions continue to evolve. They don't replace modern medicine, they inform it. And in doing so, they remind us that sometimes progress doesn't mean leaving old knowledge behind. It means finally understanding how to use it. Throughout this journey, we've seen how ancient medicine wasn't primitive. It was observant, methodical, and often surprisingly effective. From surgery and sanitation to ethics and herbal care, ancient civilizations laid the groundwork for what we now call modern healthcare. And some of their discoveries still live on in our hospitals, in our pharmacies, and in the principles that guide how we heal. And now, as promised, let's return to one of the most startling facts from the ancient medical world: brain surgery. Archaeologists have found human skulls, some over 7,000 years old, with clean, intentional holes cut into them. This procedure, known as trepanation, involved removing a section of the skull, often to relieve pressure from head trauma or to treat seizures. These weren't random acts of desperation. They were carefully executed, often with tools designed for the task. But here's the most incredible part. In many of these skulls, the bone shows signs of healing. That means the patient survived. In some cases, they may have lived for years. In parts of ancient Peru, survival rates from trepanation may have exceeded those of Civil War battlefield surgeries nearly 6,000 years later. These early surgeons didn't have scalpels or antiseptics. What they had was experience, observation, and a growing understanding of the body's capacity to recover. They weren't guessing, they were learning. Ancient medicine wasn't a detour on the road to modern science. It was the first step. And in every tool, every tablet, every scar left behind, we see the proof that human ingenuity didn't wait for the modern age to arrive. Thank you for joining us on this journey through the forgotten roots of modern medicine. If you found this exploration eye-opening, consider supporting Armchair Archaeology by giving this video a like and subscribing to the channel. It helps us uncover more hidden connections between the ancient and the modern. Don't forget to hit the bell so you never miss an episode. And we want to hear from you. What other ancient inventions or healing traditions would you like us to explore next? Let us know in the comments. And if you want to explore even more lost knowledge, from forgotten cities to unexplained artifacts, our ebook Secrets of the Ancient World is a perfect next step. It's like having a mini armchair archaeology in your pocket. Until next time, keep questioning, keep exploring, and keep the flame of curiosity burning bright.